Hi, we are here at the Optimal Health Primary Care with Dr. Jeffrey Brown. Dr. Brown, can you tell us about functional medicine?
Functional medicine is an integrative healthcare approach that treats illness and promotes wellness by really looking at the biochemical unique aspect of the patient. And from there, then we can develop some interventions that are tailored for the patient that's going to help restore their physiological, psychological, and structural balance.
Dr. Brown, what is the integrative medicine?
Integrative medicine is basically combining conventional medicine with alternative therapies.
Would you define what is anti-aging medicine?
Some people look at anti-aging as far as, okay, how do I look on the outside? And then most of us, I mean, those like me, I believe what's going on in the inside.
Yes.
All right, we're trying to slow down the aging process, slowing down how your body breaks down. How fast does it repair? So as you age, the repair process takes much longer. So anti-aging medicine is basically equipping the body, through nutrition, through hormones, and all type of testing to see, okay, where are we missing? What's going on here, so we can try to slow that process down, trying to equip the body to have what it needs so it can heal itself.
What health condition would benefits from your alternative therapies?
One of the things that we do is hormone balancing. Men and women's hormones, using bioidentical hormones, is key for putting your body back into balance and actually the prevention of disease. And we could spend a whole lot of time just speaking about bioidentical hormones. We also utilize intravenous nutritional therapy, okay? And that's basically sitting in the chairs that we are now and receiving vitamins and minerals and amino acids and other things to help heal. And we treat a lot of different conditions with that, fibromyalgia and chronic fatigue and adrenal dysfunction, and we can go on about that. We also do ultraviolet light blood therapy.
What is this UBI therapy?
The UBI, for those who don't remember, the ultraviolet blood irradiation therapy works really well with fighting infection. So if you came down with a shingles infection, 3 treatments, 3 days of treatments for the shingles can pretty much knock that out instead of suffering for a long period of time. If you're starting to have the flu, pneumonia, bronchitis, yes, it's a great treatment to start right away. They've had great success with treating AIDS and HIV patients, here in this country and in Africa. It works very well for, let's say, autoimmune diseases, lupus, rheumatoid arthritis, because it's oxygenating the tissue, it's reducing inflammation, it's dilating blood vessels so you can bring more nutrients and oxygen to the area and give you energy so you have less pain.
What is the high power laser therapy?
We have a class 4 high power laser therapy, basically laser light that penetrates to help heal. Okay, and I use this for neuromusculoskeletal pain. People who have low back pain, sciatic pain, headaches, carpal tunnel, RSD. A lot of pain works really well with this therapy. It also heals injured tissue. So a lot of professional athletes use it. So if you get up running, you pull a muscle or a ligament, it helps to expedite the healing. It works really well for healing ulcers and wounds. So this laser has a lot of uses for it, and we've seen some great results with it.
What is this acupuncture therapy?
We use a machine that we use to test the meridian, looking at your balance, for lack of a better term. And then we plot these points on a graph, all right? And so on that graph, I can see the points that are outside the norm and then those who are inside the norm. So the first thing we do is balance your meridians. So we have one needle that's electrically based, and we treat those points outside the line. And then we go ahead and we'll treat the local points. So if you have pain specifically, there's certain points that it hurts here, and we go ahead and treat those points. And then there's special points for any type of condition maybe out there. And then we use the ear, which is auricular therapy, to treat the pain. So we have 4 steps that we use to make sure the patient is out of pain. So if you come in pain, usually most people leave 50, 75%, and sometimes 100% better than when they came in. And then as you continue the treatments, with one treatment, yes.
Wow. Thank you, Dr. Brown, for all this wonderful information, and we're very happy because we know that you are just 5 minutes away from Sun City Anthem. And how can we get hold of you?
Well, you can give us a call, 871-7004. But we're also located right across the street from St. Rose Sienna Hospital on the same side as McDonald's.
Okay. And your website address is?
www.optimalhealthpc.com.
Thank you very much. This is Sophia from Channel 99.